cervical carcinoma. It's the carcinoma that originates from the inner surface of the cervix, which is the neck of the uterus. Diagnosis of the carcinoma. Pap smear test is performed. The material collected from the cervical canal and is sent to the lab for microscopic study about the precancerous stages or the dysplasia changes in the tissue of the cervix. This is usually performed at the age of 20 years up to 65 years. And after each 3-year period, it has to be screened in the females to locate the possibility and the chances of carcinoma in the cervical canal. So it is a preventive measure. By means of this test, screening test, we can detect prior to the formation of the cancer, and we can adopt the preventive and medical treatment and surgical treatment also easily. Biopsy test. Biopsy means that the tissues which are suspected, they are excised in small quantity through vaginal route by means of colposcope, which is an instrument fitted with the lens and light. So by this instrument we can also inspect the interior of the vagina and also the cervical canal. So the tissues are excised and sent to the laboratory for microscopic surgery, by microscopic study to detect the chances of carcinoma. So there is a forceps for biopsy, and also there is cervix conization and loop electrical excision method of biopsy. Now there is also X-ray, ultrasound study and MRI, CT scan of the uterus, so that we can look at the position and the size of the tumor present in the cervical canal. The treatment of the cervical cancer. Medical treatment consists of chemotherapy, targeted therapy, immunotherapy, which is the latest method of treatment. There is a group of medicine which are employed to boost up the capability and potency of the immune system of the patient, and also these medicine help to detect the location of the cancer tissue. Radiotherapy, which is consists of high voltage radiation of X-rays from external source, and as well as by the internal method of treatment by means of radioactive seeds implanted in the cancer tissue or around the cancer mass. Radiotherapy is helpful along with surgery, prior to the surgery, to reduce the mass of the and size of the tumor, and even after surgery when the remaining tissues are destroyed and killed by the radiation. Surgery is performed only when the tumor is limited in the inner surface of the cervix and has not extended into second, third or metastatic stage. So in this case we can perform colposcopy to examine and observe the size and position of the tumor or cancer cell in the cervical canal, and we excise the suspected tissue. by means of lasers, cryosurgery, and also the removal of the cervical canal along with upper part of the vagina. But in this method called colectomy, in which only the cervical canal is excised and the uterus is kept there for chances of the pregnancy, to save the option for pregnancy. If the cancer tissue has spread or disseminated to the various other organs of the body, especially the pelvic organs like bladder and bowel, then we have to perform total hysterectomy, removal of the uterus, vagina, and the various organs of the pelvic cavity along with the lymph nodes. So in this method we perform robotic surgery or the conservative or traditional open abdominal surgery to remove the uterus as a whole.